Picture an ordinary Tuesday evening. A man named David is halfway through a sentence at the dinner table when his hand goes weak and his fork slips onto his plate. The right side of his smile stays frozen, like a photograph that never finished loading. Nobody at the table knows it yet, but a silent clock has just started. Somewhere inside David's skull, almost 2 million brain cells are dying every single minute. If that biological clock is already running, what exactly is it counting down to? And is there any way to halt it? The answer to that question is the single deciding factor in what happens next. It dictates whether David walks away from this table intact or loses the life he knows. The human brain is a spectacular energy hog. It takes up barely 2% of your total body weight, yet it demands a massive 20% of all the oxygen you breathe. Your muscles and your liver are capable of storing fuel. Your brain cannot. It lives entirely hand-to-mouth, dependent second by second on a constant river of blood arriving through its arteries. This medical illustration shows the dense, branching network of blood vessels at the base of the brain. An ischemic stroke happens when a clot acts like a cork, jamming one of these pipes and immediately cutting off the oxygen supply to everything downstream. Because the brain keeps absolutely zero biological backup power, a blocked artery doesn't result in a slow wind-down. It triggers the most rapid and dangerous cellular collapse in the human body. When blood flow stops, the affected patch of brain tissue does not die all at once. It actually fractures into 2 distinct geographical zones. Right at the center is the core. This is the epicenter of the blockage, where the blood flow collapse is absolute. Neurons here begin dying immediately, and the damage cannot be reversed. This eclipse diagram shows a dark center surrounded by a lighter outer shadow, the penumbra. Doctors use this term for a stroke's second zone, a twilight band wrapped around the dead core. These quiet neurons survive on a trickle of blood from tiny detour vessels. If normal blood flow isn't restored, these starving cells slide from the penumbra into the core. The dead zone slowly consumes the living edge, spreading outward minute by minute, like ice across a pond. Down at the microscopic level, a desperate fight is taking place inside that starving zone. A healthy brain cell actively pumps charged particles across its membrane. Without oxygen, these pumps fail. Particles flood inside, causing the cell to swell. Calcium pours in, triggering self-destruct machinery. The dying neuron spills toxic chemicals outward, dragging healthy neighbors into the same downward spiral. Zoom out, and the math of that chain reaction is staggering. In a single untreated minute, a typical stroke wipes out 1.9 million neurons, 14 billion synapses, and 7 miles of internal wiring. Translate those numbers to a human scale. For every hour a stroke goes untreated, the affected brain forcefully ages by 3.5 years. The entire medical response to a stroke is driven by one idea. Doctors are not fighting for the core, because the core is already gone. They are fighting exclusively to rescue the penumbra. Hospitals have an incredible arsenal to do this. There are clot-busting medications injected straight into a vein and tiny catheters that specialists use to physically pull blockages out. But these tools are strictly viable only within a 3 to 4.5 hour window. Because every single treatment is changed to the clock, the most powerful person in a stroke emergency is not the surgeon. It is the bystander sitting across the dining room table. Even the greatest hospital in the world is entirely helpless if someone nearby does not recognize the collapsing penumbra in time. You do not need a medical degree to recognize it. You only need 6 letters. Be fast. Sudden loss of balance. Eyes losing vision. One side of the face drooping. Arms drifting downward. Speech slurring. And time to call emergency services. Stroke symptoms are usually painless, so waiting to see if they pass is a common and fatal mistake. And driving the person to the hospital yourself means you skip the vital en route treatment that paramedics provide. If the symptoms appear and then vanish completely within a few minutes, it is a transient ischemic attack, or mini-stroke. A clot blocked an artery and cleared on its own. It is a biological warning shot that a much larger stroke is imminent. Let's go back to David at the table. His fork hits the plate, and his smile droops. But because one person at that table knows the signs, the story changes. That person acts immediately, dialing for help in the first few seconds. Millions of neurons are still hanging on in the twilight zone. A stroke relies entirely on time, but human recognition intercepts the clock. Knowing what you are looking at is the exact intervention that pulls the penumbra back from the edge.